Director of Disease Surveillance and Environmental Services at the Mobile County Health Department, here to give you a brief update on the effect of pandemic coronavirus on Mobile County and our community. Again, we always start with the global outlook. So worldwide, 4.8 million cases with over 300,000 deaths. In the United States, 1.5 million cases of COVID disease with 90,000 deaths. In Alabama today, the dashboard was reporting over 12,000 cases of COVID-19 disease with 493 deaths. And in Mobile County this morning, in our detailed report, we're reporting on 1,755 COVID-19 disease patients. 207 or 12% of those are hospitalized, and 103 have died with illness. That's 6%. We've had an increase of a couple of deaths over the last 24 to 36 hours. I'm not going to go in great detail about the descriptives of the patients today. We spent a lot of time looking at that yesterday, but I do want to sort of alert you to a couple of things that may be changing as we go forward. You know, yesterday I reported that the map that the city of Mobile is assisting us with, and we're very grateful for, we will just be updating that once a week on Mondays going forward. And as soon as we have some additional information on the geography of our cases, I'll be happy to share that with you. The county, Mobile County GIS analysts are assisting us with that, and we're really excited to look to what they are able to share insights on. But we pretty soon will stop reporting, showing the graph that shows the number of cases reported by day, because the report date is very heavily influenced by things like when the doctor's office was opened, when your lab specimen was collected, you know, how fast did the specimen get to the lab, was there a machine down at the lab that day, you know, how quickly did the results get back to the provider, you know, does the provider have the, you know, immediate capability to contact and tell people about positive test results. So we are beginning to look at the data by week of report, not by day. Of course, we will still look at the number of cases reported daily. But when I look at the number of cases by week, there actually has been sort of, we've been hovering around the same number of cases by week in the low 400s. So about 36, 38 cases on average are added each day, and that has stayed fairly stable for the last 2.5 weeks or so. I get a lot of questions about, oh, it's still going up, and actually what we have seen is that it appears that for now it is staying about the same when we look at it by aggregating it by week or by some other metrics, like we do look at a moving average to sort of try to calm the noise in the day over day reporting. What generally happens, because the laboratories are closed on Sunday, is, you know, and most people do not, you know, there is not a lot of testing on the weekend. We see a small number of cases reported Monday, and then it starts to go up Tuesday, Wednesday, Thursday, Friday, and then we see a big spike, and then it falls back down. So that makes it really difficult to kind of see what's happening over weeks. So we'll be making some changes to our report to reflect that. A little bit more on our outbreaks in congregate settings. So I've been reporting on 7 long-term care facilities with widespread transmission, and we know that these outbreaks are contributing to about just over 50% of our reported deaths. So right now, 57 of our 103 deaths are associated with long-term outbreaks. In addition to the 7 that have COVID in their facility, we have a few that have foci of transmission. So this means they maybe just have 1 or 2 patients or staff members who have tested positive. And so we're working really closely with them. There's still a good chance that they can contain the infection in areas of their facility and it not become widespread. Then we have about 3 facilities that have tests pending, either on staff or residents. They don't know the results yet. And we have 27 of our long-term care facilities that are reporting 0 cases. So this is really important that to know that of the 37 in our community, only 10 of them are affected by the COVID pandemic. 27 are reporting 0 cases. And then in other congregate settings, again, we have an outbreak in a detention center that seems to be just, somewhat contained. They have very few people that are being isolated in that detention center, which means they just have a small number that are ill. The overwhelming majority of inmates that have tested positive have recovered. We had a group home early on that we were investigating. We have a treatment facility that has had a case or two, 3 senior living complexes. This is really important to talk about and focus on for a second, because senior living complexes are usually feel and look like apartment complexes where you have your own unit, but you're inside a larger building. And it's important to know that your home, where you are supposed to be staying safer, is inside your unit. You should not be congregating at spaces within the building or within the facility. So we hear reports of senior citizens, those folks that are at greatest risk for severe complications, gathering in gazebos or on park benches outside or in common areas, and this is absolutely dangerous territory. So once COVID gets into the facility, if people who have those risk factors for complication, if you get ill, you are putting yourself, if you get infected, you're putting yourself at risk of severe complications and potentially death. So please, if you live in a complex, an apartment complex or a high density building, or maybe a campus that has several complexes on it with single apartments where senior citizens are living, please do not congregate anywhere in that complex, including, going to someone else's apartment and that sort of thing. Your family unit is who lives in your unit, and that is considered your home, and you are safer at home. So I will not belabor that point any further. So sorry for me getting on a soapbox there a little bit, but it's just so important, because again, we have, greater than 80% of our patients who die are 65 and over, and 60% of those who are hospitalized are 65 and over. So I just want to make sure that you recognize the behaviors that you need to sort of curb to protect yourself. All right, so a couple of questions and other messages to put out. Yesterday, I talked a little bit about a CDC report talking about the decline in childhood vaccination coverage during the COVID pandemic in Michigan. And I wanted to bring that up again, because it is so important. So in this study out of Michigan, up-to-date vaccination had declined 50% among children less than 2 years old. So it's super important that while, yes, we want you to stay safer at home in a very controlled way, it's important that you continue to get recommended vaccinations for your small children, and also throughout all stages of childhood and adolescence, not just those that are 2 years old. So please check with your pediatrician or your healthcare provider and take a look to make sure that your child is compliant with all of the recommended childhood vaccinations. All right, so this is from, so Brad Phillips, our inspection services district manager, sent some really good information, because they take calls from the public, and so they hear what people are asking, and he sent this note to say that some news outlets are still consistently reporting that bars and restaurants are restricted to 50% capacity. There is nothing in the current order directing bars and restaurants to reduce to a certain percent capacity. They just have to maintain physical distancing requirements of 6 feet between patrons at different tables, chairs, booths, stools, and limit party sizes at tables to no more than 8 persons, and those 8 persons should be your immediate family. not 3 from your family and 5 of your neighbors. So the 50% capacity limit was only required for retailers. So again, that does not apply to bars and restaurants. Brad goes on to say that he's still finding restaurants offering self-service food, drink fountains, and condiments, and the order specifies that restaurants and bars must disallow self-service by guests at drink stations, buffets, or salad bars. So customers may not fix their own drink, get their own salsa, grab condiments, ketchup and mustard for their hot dog out of a pumper. It has to be single serve and at the table. They may either served at the table or provided on the table. No drink stations, buffets, or salad bars. Let's see. And then the other comment from Brad, wow, he was quite prolific today. You might have seen that the city of Mobile passed an ordinance to allow restaurants and bars to provide additional seating outside, like on the sidewalk or in parking lots. And Brad's just saying that the health department doesn't have any issue or concerns about additional seating outside or tented seating, provided that physical distancing of 6 feet is maintained between patrons at different tables. So there. Maybe just to mention that, other than companion animals are not allowed in restaurant settings, and this would include outdoor seating areas. All right. So here are some questions from Facebook. Will we ever see the numbers dropping? Seems to be getting worse than better. Wow, just wow. So yes, the number continues to rise, but the rate at which it is rising seems to be slowing some. And that is largely due to the stay-at-home order that was in place until last week. Now that the safer at home order is in place, which relaxes some of the restrictions, it will be some time before we see if our case numbers start to rise, because there is increased community transmission now that people are allowed to go back to church and in retailers and back to restaurants. We are watching it very closely because we have been happy to see things, the trend slowing down and flattening, which was the purpose of the stay-at-home order. And now we will keep a close eye on the trend with the safer at home order. Some questions about testing inmates and staff at the detention center. There is plenty of capacity for testing. So the people at the jail, both the inmates and the correctional officers that are appropriate for PCR testing, are able to get that testing. This is a question about California, which I'll just pass over. Why are humans saying the virus is dead? I have no idea. The virus is very much alive. No one on the planet had prior immunity to the virus. It is more infectious than flu, so it is highly contagious. So it is a very serious threat. How do you show no symptoms after a test positive if you have to have symptoms to get tested in the first place? We have had testing in areas like congregate settings where if we would get a positive patient or resident or worker, then we would go and do ring testing around those folks to test the people that had been in close contact, regardless of whether or not they were symptomatic. And we started, seeing positive tests in these people that had no symptoms. So that was recognized, weeks ago, that there was asymptomatic infection. And more testing has become available. Many places, including the test facility or the facilities at the Mobile County Health Department, do not have a requirement for symptoms to be tested. So at our locations, and probably others starting soon all across the state, I believe Huntsville just made an announcement that they're testing anyone who needs to be tested. But here at the Mobile County Health Department, if you feel like you need a PCR test for COVID-19, we will test you at no cost to you. Here is a question about infection rate, and so I will look at that and comment on that tomorrow. I have not calculated it lately. Okay, with these are media questions. With Memorial Day upon us, a lot of people clamoring for outdoor entertainment. Is it too soon, too early to loosen health orders to accommodate reopening? That I know of, in Alabama, at least in Mobile, outdoor concerts and those sorts of things are still restricted. But again, we have to pay close attention to the health orders, and anytime you're out in any size congregation, you have to maintain that 6-foot distance, and we want you to wear a cloth face covering. See, someone asking a question about how do we feel with the number of tests being conducted, commenting on one of the testing locations that was cut way back because of lack of demand. We have seen week over week a dramatic increase in the number of tests that are conducted. I think the last time I calculated, over like a 3-week period, it had increased 396%, or some really large figure like that. So we are really happy with the increase in testing that's going on in Mobile. Even though we have a lot more tests that are being conducted, again, we're not seeing that contributing to a parallel rise in the number of positives. But I would like to see more testing throughout. I think that it's more of a case of people not getting the word. Maybe people still think that they can't get tested unless they have symptoms, and in most cases that's not true anymore. If you're an asymptomatic healthcare worker, if you're an asymptomatic and have an underlying health condition, there are all of these circumstances under which you can get tested, and at least at Mobile County, if you just feel like you need a test, you can get one. So I think we need to get that message out, that we want to reverse this myth that it's too hard to get tested, and try to encourage people to get out and get tested near them, and to do it safely. Just as few, just yourself in a car, or just you and the underage family member to go and get tested. And again, wearing the face coverings and maintaining that distance and calling ahead. Most people prefer, or most locations prefer, for you to make an appointment. And the testing locations around the county are available on our website. So we'll make sure to put another link on our Facebook page so that folks know where to get it. Another question about asymptomatic. Yes, there is a lot of asymptomatic PCR positive out there. We know that. Someone asked me to comment on a study in South Korea. I have not read that study. Someone asking me to comment on a specific housing location, apartment complex or high density housing location that may have cases, and I cannot comment on the name. But yes, we know, as I've just mentioned, we have at least 3 senior citizen complexes with cases. And then here's another reference to something that the mayor is providing. And this was about the number of active cases in the hospital. Public health has access to that information, but again, that's just for internal decision making. So it is a little bit tricky to know who at any given point in time is in the hospital or on a ventilator, because that changes so quickly. And the hospitals are very busy right now, so trying to ask them to report in real time to us is a bit of a burden to them. So I think that is it. Luke, yesterday you were asking me to talk about something, and maybe in greater detail, and it totally slipped my mind. Do you remember what it was?
You covered it.
I did?
Yes, it was detention facilities.
Okay, detention facilities. Okay. So that is our update for today. Again, tomorrow, normally on Wednesdays, the Unified Command, the mayor, the health officer, the county commissioner has a press conference tomorrow afternoon. It looks like that will take place, so we will not have a 2:30 Facebook Live. We'll see you on Thursday. Thank you.